Yeah, we're almost there. Prof, we're there confidently. I have to introduce you again as a former commissioner for animal resources and fisheries in Sokoto State Government Executive Council. Please permit me to, because I've not been there. So if I make any alteration, please permit me. Don't mind my shortfall. Is and former Dean of Faculty of Veterinary Medicine, Othman Danfodio University, Sokoto. Former elected member of the Veterinary Council of Nigeria, a professor of public health. Now, sir, we are calling you now to moderate this floor. Thank you very much, sir.
Thank you very much, Charles, and good morning, everybody. Let me welcome you all to this interesting edition of this week's presentation, which is on rabies, as we mark the Rabies Day across the world. And we are lucky to have and the president Uchenna Eze, who is a mother, a researcher, a clinician, and an associate professor in the Department of Veterinary Medicine, Faculty of Veterinary Medicine, University of Nigeria, Nsukka, as well as a consultant in the Veterinary Teaching Hospital of University of Nigeria, Nsukka for 13 years now. Born on the 29th of January, she hails from Enugu, in Enugu North Local Government of Enugu State. She attended Queen's School, Enugu State between 1996 and 2000, before proceeding to University of Nigeria in Nsukka in 2001 and obtained Doctor of Veterinary Medicine degree, with so many awards, including the best graduating student in the faculty, and also obtained her Master's and Doctor of Philosophy in 2009 and 2013. She is a fellow of the College of Veterinary Surgeons of Nigeria with specialty in small animal medicine. Ukamaka is currently a fellow of the Research Development Fellowship sponsored by African Research Excellence Fund. Her research fellowship is hosted by the Department of Veterinary Tropical Diseases, Faculty of Veterinary Sciences, University of Pretoria in South Africa. Dr. Ukamaka Uchenna Eze had held various positions as chairperson of different committees in the Department and Faculty of Veterinary Medicine, UNN. She was the immediate past head of the Department of Veterinary Medicine, University of Nigeria. She has over 40 published articles in reputable peer-reviewed journals, both national and international. She is married and blessed with 3 children. Her hobbies include dancing, listening to reggae music, and watching documentaries. I'm pretty sure she shares similar hobbies with our chief host, Dr. Charles Ibe, because I know Ibe loves dancing. So even if he doesn't listen to reggae, I know, I can confirm, because we have attended many occasions where I know I had to ask him to sit down because he has danced enough. So, ladies and gentlemen, colleagues, you are most welcome to this forum. And it is my pleasure and privilege to introduce Dr. Ukamaka Uchenna Eze to please make her presentations. Over to you, Dr. Ukamaka. Thank you.
Thank you, Prof, for presenting me to this platform. I'm very, very honored. You know, when your guy at the top is introducing you, your head will swell. So I'm very, very happy, sir. Thank you for that. I want to share my slide now.
Please go ahead. Thank you.
Okay. So can you see the slide?
Yeah.
Yes, but you can put it on a slideshow.
Okay. Let me go to
Top, at the top, slideshow at the top.
Yeah,
Slideshow
I
at the
want.
top.
Slideshow at
I've
the
seen
top.
it. Yeah, I've seen
Yes,
it.
yes.
Click on it.
Click on it. Okay.
Now go from the beginning. Yeah, currents from the beginning. Exactly.
Yeah.
Very good.
We
Can
are
you see it
learning.
now?
I've learned myself. Thank you, sir.
Okay. So I want to thank everybody, especially the VAT, the Blue VAT TV for bringing me.
I think it's better now.
Okay, it's better, right?
Yes.
Okay. So
Yeah.
I want to thank the Blue VAT TV for seeing me as worthy to be the one to present today, and also for Professor Jinaidu for agreeing to moderate this. It's not an easy thing for, for a professor with so many experience to come and moderate a young person like me. I'm happy. So today is a World Rabies Day, like we all know, and um, is also the death and the memorial of our father who founded the anti-rabies vaccine, Louis Pasteur, in 1885. So we do this in commemoration of his death.
Doctor, can you speak louder now?
Okay,
Can you speak louder?
Can you hear me now?
Yeah, but frankly, come up a bit in your voice.
Okay, can you hear me now?
Yes.
Okay.
Dr. Ukamaka, can you speak?
Can you hear me now?
Yes, but loud a bit.
Okay. Is it okay now?
Yes.
You have to shout out as if you're teaching in order for them to hear you well.
Yes, we can hear you now, loud enough. Yes.
Oh, okay.
Yes.
So so today is a World Rabies Day, and our topic, the title of our discussion today is World Rabies Day Introspections. But the theme of a World Rabies Day this year is breaking rabies boundaries, to be able to stop rabies or to eradicate rabies, dog-mediated human rabies by 2030. So that's what today's theme is. So as we all know, rabies is one of the diseases that has name in different languages. In Nigeria, every tribe has a name for rabies. And in Igbo, we call it Nkitara. In Hausa, it's called Shiwonkare or Siwonkare. In Yoruba, Dibolugi. In Fulani, is Gindaji. In Efik or Ibibio, it's called a Dautebu. And of course, in English, it's called a mad dog. So you see that this disease is not our mate, is an old one. So by way of introduction, rabies is an ancient disease, a disease that is recorded in a Codex of Ashuna of Babylon in 1830 BC. This disease has been there, during that period when somebody's dog bites somebody and that person comes down with rabies, the owner of the dog will have to pay a fine. So this disease has been there. So it's not a young disease, an old disease. By now, this disease should not be a problem, but unfortunately, it's still a problem in our society. It affects all warm-blooded animals, including humans. And it causes the death of 60,000 people worldwide. And about 21%, that's about 36% of the human deaths is in Africa. And 1,600 human deaths in Nigeria. And of course, you know that this is underreported, that we have more deaths in Nigeria than this 1,600, but this is what is recorded. So that's why that is the documents we have, and that's why it's what is reported. Then it's worthy to note that children under the age of 15 are at the highest risk. This is because they are the age brackets that can play with dog. A dog will bite them. They will hide it from their parents until they come down with this disease. So we should pay attention to this group of children. So what is the etiology? What causes rabies? This is not just vets alone. There are other people, because I invited a lot of people to this platform. So I know that there are some people who don't understand vet terminology. So I will try as much as possible to, not to be so professional while discussing this. The cause, what causes this disease is lyssavirus rabies. We call it lyssavirus. Before now, it was called rabies virus. Later, they called it rabies lyssavirus. Now, it's called the lyssavirus rabies because of the International Committee on Taxonomy of Viruses. They keep changing these things. So I will be interchanging it with rabies virus, lyssavirus rabies, and rabies lyssavirus, because, like when you get married, you find it difficult to answer your surname. You keep writing your maiden name until you get used to it. So I will try as much as possible. I will be interchanging the names. But this lyssavirus rabies and 17 other lyssaviruses are the cause of this disease known as rabies. And they belong to the other mononegavirals, family Rhabdoviridae, and genus lyssavirus. This virus is a negative sense single-stranded RNA virus, which is approximately 12 kilobases. It encodes 5 structural proteins. You can see it on the. I don't know where my pointer is.
Yeah, we are seeing it. We are seeing it. Yeah.
Okay, you can see it. So, so these numerous spikes. It's about 180 nanometer long and 75 nanometer wide. Then the lipid bilayer contains 10 nanometer spikes. It contains the glycoprotein, and the glycoprotein is the target for our rabies vaccine. So this is the structural proteins. The N gene, the one in red, is the most conserved of all the structural proteins. So when you want to amplify the gene of rabies, and you want to compare it with other from other countries' rabies viruses to know whether there is similarity and all that, it's always good to do this engine, because that's what most people do. There are some people that also amplify GL intergeneric region, that's between this G and L. But nucleoprotein is the main gene for that. So these lyssaviruses that are now 18 in number, I hope you can still hear me.
I'm hearing you well.
Very well.
Okay.
We are hearing you well.
Okay, so these lyssaviruses are divided into 3 phylogroups based on the phylogroups are based on their phylogeny, their cross-reactivity, serological cross-reactivity, and also their pathogenicity. So, Africa, there's a noise somewhere.
Who is making the noise?
Okay, so the African continent is the only continent that has lyssaviruses in the 3 different phylogroups. The Duvenhage lyssavirus in phylogroup 1 was first isolated from South Africa. Then Mokola lyssavirus and the Lagos bat lyssavirus were first isolated in Nigeria, in a Mokola district in Ibadan and the Lagos Island. The Lagos bat shimoni is was isolated from first from Kenya, and then in phylogroup 3, Lagos, lyssavirus Ikoma was first isolated in Tanzania, and the phylogroup 2 are mainly African lyssaviruses, because the 3 of them were first isolated from Africa, and 2 out of them were from Nigeria. That's the Lagos bat and the Mokola lyssaviruses were from Nigeria. So what are the hosts of these lyssaviruses? The principal host of a lyssavirus is dog. Dog is the principal reservoir host. Then cats, our domestic cats, wild carnivores, and bats they also maintain and transmit this virus to other animals and to humans. So transmission, how can one get this virus? Can get this virus through bite of an infected dog. Bite and scratches, because if a rabid dog scratches you, or cat or bat, and their saliva touches that scratch, you are going to get rabies. Then also bite of infected wild cats, wild carnivores, cats and bats, organ and graft transplants from donors who have died of undiagnosed rabies has also been shown to expose people to rabies infection. Then exposure of mucous membrane to infectious saliva. For instance, if rabies virus touches your mucous membrane, maybe your eyes, maybe the saliva of a dog touched your eyes. For instance, there is this kudu antelope in Southern Africa, especially in Namibia. They don't bite, but because they browse on acacia plants, which has more thorns. So when they browse there, the one that has rabies will leave the saliva, the other one will come and bite. And you see that there is an epidemic of rabies in those kudu antelopes. So these are some of the ways where how someone can get rabies infection. Then it's worthy to note that domestic dogs and cats may shed virus up to 10 days before the onset of clinical signs. So that's a dog bites you or a cat bites you, that's you might, and the dog is not showing clinical signs of rabies. That doesn't mean that that dog is free of rabies. And that's why normally keep the dog, you quarantine the dog for 10 days to know if the dog will come down with rabies. But we have other thoughts and the school of thoughts concerning this particular thing. As we go forward, we will still see them. So this is the pathophysiology of rabies. Once a rabid dog bites the victim, the virus multiply locally in that myocytes. That's the muscles of the area which the bites occurred. If it's the leg or the hand or wherever, the virus will multiply locally. Then from there, the virus will bind to the nicotinic acetylcholine receptor. That's it will bind on the nerve and then bind to the nerve by retrograde axonal transplants. It will move to the dorsal root ganglion. Then from there, go to the spinal cord, then to the brain. Then when it gets to the brain, it will multiply and also now from there spread to this the salivary gland. That's where it now starts seeing it in the saliva. You start seeing it in the sensory nerves, so you can even the skin and the eyes. So that's how rabies infection moves. So then the clinical signs. The incubation period of rabies is highly variable, 10 days to several years. Like I said earlier, sometimes you will see that they hold a dog bites somebody, you keep the dog for 10 days, the dog doesn't come down with rabies, you release the dog, and the person that was bitten will come down with rabies. It has happened before. When I was collecting my samples at Obwede, around the Soka area, there was this man that his dog, he was bitten by his own dog. Then nothing happened till after. The dog did not die. The man didn't believe that there was something wrong with the dog. Nobody believed that something was wrong because the dog was behaving normally. Then after like 3 months, the man started developing clinical signs that are clinical signs of rabies. And they now were like, what happened? So they now said that whether a dog bit him or what. So they now found out that his dog was bitten by his dog. So they killed that dog. So that was the period I was collecting my samples. They gave me the dog, the brain of that dog. I took it to MVRI, and when they checked for rabies antigen, it was positive. That dog was positive of rabies, but that man died because nothing could be done at that time because he was already showing clinical signs of rabies. So, and the dog did not even show the signs of rabies until that dog was killed. So you see, there are different incubation period of rabies. And so it's often advised that once somebody is bitten by an unknown dog, or even if you know that the dog, even if the dog is your own and you know that you did not vaccinate this dog or you don't vaccinate this dog, you should seek for medical help. So what are the factors that will influence this incubation period? Rabies virus inoculum, it depends on the quantity of virus that was in the bite area, then severity of the wound. If a wound was very deep or if it was superficial, then it will determine the incubation period. Then size of the bite also matters. If somebody was bitten at the extremity, that's the toe, the time it will take for rabies to move from that toe to the brain will be different from if the person was bitten on the face. So you see that site of bite also really matters in the incubation period. So the clinical forms of rabies, we have two main clinical forms, but the prodromal period, that's the period before the person will start showing specific signs, include fever, anorexia, malaria. It will just be like normal, normal flu-like or normal initial disease. The animal will be feeling irritable and all that. Then abnormal sensation around the wound. But our dog cannot tell us that it's having abnormal sensation around the wound, but it might just be, biting the place or scratching that site, showing you that there is something wrong with it. If a dog was bitten by a rabid dog, and these are some of the clinical signs you see in dogs. So the furious form or Magdus syndrome, irritable, and the animal will be very, very irritable at the slightest provocation. And that's why initially they will ask you, when you say that you were bitten by a dog, they will ask you, is it a provoked bite or unprovoked bite? But I tell you that these days, whether it's provoked or unprovoked, you should seek medical help. Then aggressiveness, the animal becomes very aggressive. It's the posture will be that of alertness. Then the pupil will be dilated. Noise invites attack, and it's usually become vicious. The animal that normally is not a vicious dog, just all of a sudden becomes vicious, attacks people, bites people. Then the furious form continues. So such animal lose caution or fear of other animals. If it is wild animal, wild animal will bite other animals. It will even bite humans. It will come out. There was a case yesterday in rabies lab. There was a case that was brought, a jackal. This jackal beat some of the cattle beat some of the cattle where they were grazing. It came out from the wildlife area, entered the domestic area.
Hello? Hello?
Can you hear me?
We are hearing you.
Okay.
Continue.
So it came out and beat some cattle. Then even the owner was even beaten by the same jackal. So imagine that kind of thing. So the animal will just lose the fear of other animals, lose the fear of humans. Then the animal will equally roam extensively. You see some dogs running like somebody is pursuing them. They'll keep running, and they will keep attacking other animals, attacking even inanimate objects. Then they commonly swallow objects that they normally would not, like grass, straw, sticks. And the young pups will seek human companionship, and even they will bite you. Even when you're trying to pet them, you see that they will just bite you. Yeah. And the dumb or paralytic form, this one is dicey because such animals can easily bite you without knowing, because animal will be very quiet. It will be very quiet, hides in a dark place. Then it has a paralysis of throat and masseter muscles. Then there'll be profuse salivation and inability to swallow. So you think that something is choking it. Then the jaw will be drooping. Then there will be signs of choke, like I said. Then this animal may not be vicious and rarely attempt to bite. But when you go and try to know what is wrong with their throat, or what is wrong with their throat or that, then that's when they will just bite you. So the paralysis will now progress. It will keep progressing until the animal animal gets to coma and then dies within few hours. Then we have species variations. For cats will be aggressive, uncoordinated, fraught in muscular tremors. Then the pupils will be dilated. Then they keep staring. And they will assume this threatening posture. There will be abnormal vocalization, lack of response to owner, unprovoked bites. Then there will be convulsion, paralysis, coma. The animal will even be hiding away. So some cats will appear unusually affectionate, and try to paw, and then before you know it, you've been bitten by the cat. Then that of cattle, here in South Africa, there are a lot of cattle rabies that they bring to the rabies lab. They bring this head of cattle, because of they have a lot of wildlife area, and the wildlife conservation area and that of the domestic area are very, very close by. So when these wild animals or even dogs get ready, they have access to these dogs and to these cattle, and they bite them. So you see that the cattle, you see that many animals may have the same clinical signs at the same time. Then there will be typical Hoas bellow. Bellowing of the cattle is very typical of the rabies. Then there will be aggressive attack, vicious attack on inanimate objects, biting other cattle, attacking humans. Then there will be wind sucking. Then there's this bone in the throat. That's where people normally get exposed, because they will think that their cattle has something in the throat. They will try to put their hands to remove it, and eventually the cattle they bite them, or they might, if they have wound on their hand inside their hand without using hand gloves, and they have wound, they can get exposed to rabies. Of course, there will be paralysis, then hypersexual behavior, and decreased milk production. Then there will be grading of teeth, pica, and all that. Then for sheep and goats, symptoms resemble that of cattle, but there's hypersexual behavior, sexual excitement, then in-season bleating. This in-season bleating is so guttural that when you hear it, you'll be wondering what is happening. And then the goats and sheep will be aggressive. They will be aimless running around, pawing and paddling, and the grinding of teeth also. Then that of pigs, some pigs, you might wonder how pigs get this rabies. But you see, at least I've seen that in Jaws, they rear pigs extensively. So if a rabid dog comes to such a place and bites some pigs, you will start seeing some of these clinical signs hiding in a corner of the pen: hypersexual behavior, aggression, biting, and may even kill its offspring. Then horses and mules. There are horses also, especially in South Africa here, there are a lot of horses that have rabies. They normally have quite a few of horse cases. There is evidence of stress and extreme agitation. These signs, especially when accompanied with rolling, they've been interpreted as evidence of colic. You may think that the animal has colic because it will be thrashing on the floor, and then the horse may bite, strike viciously, and because of the size, so it will become unmanageable within a few hours. And these animals frequently suffer self-inflicted wounds. So they will also have paralysis and inability to swallow. Then bats. Bats are very important, especially in Nigeria, because we know that our Lagos bats lysoviruses were obtained from bats for the first time, fruit bats. So when you start seeing bats lying in the daytime, resting on the ground, attacking people or other animals, then and even fighting, then you should be wary, because that bat may have rabies or other lysoviruses. Then for humans, the first thing the human will start experiencing is flu-like signs. Flu-like signs such as a weakness, discomfort, fever, or headache. Then there will be tingling or prickling and sensation at the site of that bite. Then hyperexcitability, generalized arousal, hydrophobia, anxiety, aerophobia, aggression, confusion, and hallucination. At this time, the person may not be able to survive. The person will not, or let me say may not, because there is a case of one person that's been treated. We'll see it later. But when somebody starts showing these clinical signs of rabies, there is almost 100% possibility that that person will not survive it. And the remaining cases present with paralytic form. Most patients succumb within weeks of the onset of symptoms. Even with an intensive care setting, survival will always will not exceed the 1%. It's worthy to note here that humans, it has been noted that humans don't transmit rabies to other humans. So I think it can be said here that humans are dead-end hosts. But when rabies gets into humans, they don't transmit it, because of course humans will not start biting animals. But the nurses or doctors that have attended to such people, they have not been able to come down with rabies, even when bitten by such patients. So this is something that our human counterparts should look into and know why humans don't transmit rabies. So how do we diagnose this disease? First of all, for now, rabies is diagnosed post-mortem. That's when the animal is dead. You can either euthanize the animal, or the animal died on its own. They present the head to you. You collect the brain by opening the skull. You collect the brain. That's the hippocampus, the cerebellum, the cerebrum, the brainstem, medulla, and spinal cord. These parts of the brain, you will find the antigen, that's the lysovirus, in these areas. So when you have these things, you're sure that if the virus is there, you will be able to see it. Then you now take it to the lab where you can do immunochemical identification of lysoviruses. The gold standard of the gold standard test is a direct fluorescent antibody test, where you, after you make your smear and visualize it under the fluorescent microscope, you will see this apple green fluorescence. You can see that in A, there are a lot of them. So this animal is highly positive. Then in B, it's scanty. But sorry, in the first B, because it was supposed to be B and C. So the C there is the negative. The disadvantage of this lysovirus, of this fluorescent antibody test, is that it is a fluorescent microscope and it's very expensive to purchase and maintain. But I can tell you that Nigeria, we are not that poor that we can't afford this fluorescent microscope, because I believe we are a rich country. If you believe that, so say amen. So the second one is a direct rapid immunohistochemistry test. This one uses a light microscope. And when I did my PhD, we used this. And in fact, I thought that, yeah, we could now start diagnosing rabies in our university. But we discovered that the biotinylated monoclonal antibody is very scarce. They are being produced by CDC USA alone, and for now they don't even have it again. So this particular this spirit is very, very sensitive and specific. So, but I don't know what is happening. We can't get hold of the antibodies again. Then you can also detect the replication of the rabies virus after inoculation, where you use either cell culture test. That is more acceptable now. Initially, we were using a mouse inoculation test, where you inoculate young, that's a suckling mice. You inoculate them with a lysovirus, then you allow them to develop the science. You now take the brain tissue and test using fluorescent antibody, direct fluorescent antibody test, to know if they have the antigen in their brain. And this is a kind of, doing a Koch postulate of diseases, of the causative agents of a disease. The disadvantage of this is that it requires high containment area, and also you are using live virus. So you can easily infect yourself. You see my hand there, giving the small mouse the rabies virus. If anything happened and I inject myself, I'm also actually infecting myself. So, and it requires a lot of expertise before you can do this thing. Then there is also molecular technique. You can use real-time polymerase chain reaction, and this will show you the amount of nucleic acid in the virus, of the virus in the sample. Then the disadvantage is that it requires constant power supply and also is expensive. Then we have reverse transcription polymerase chain reaction, which amplifies the nucleic acid. And then it will show you you can use the PCR product and sequence it to get and trace the origin of the virus, but it's expensive and requires steady power supply. So, and it's so expensive that you can't use it for routine diagnosis. So this is a phylogenetic tree reconstructed, where you can see that if you see the green diamonds are rabies viruses collected from Enugu, from southeastern Nigeria. But you can see that there is the one down, the last one, is showing that that the virus there is actually from Niger Republic, because it clustered with viruses from Niger Republic, showing you that there's transboundary transmission of rabies in Nigeria, because importation of dogs for markets and all that. Also, in the process, rabies virus is also imported. So there is a serological test, and there are serological tests that can be done, but this is to determine the vaccination. Remember, Remember that rabies evades immunity. Can you hear me?
Yes, somebody is disturbing. We can hear you.
We can hear
Mute
you.
yourself. There are some of you here that are immutable. Yes. Man, Faru.
Please unmute yourselves, please. Please unmute yourselves. Allow the presenter to continue.
Okay, can I continue?
On the traveling vaccine.
Yeah, mute yourself. Please. Mute yourself. Shagwa, mute yourself.
Okay, like I said that when you use serological test, it is used to determine the response to vaccination, because you can't use it to detect if an animal is having rabies, because rabies evades immunity before you start seeing clinical signs. Before you start seeing antibodies in the serum of a victim, the disease is well advanced. In fact, that person must have started showing clinical signs of rabies at that time. Because what rabies does is that it enters the neuron, and in the process, it preserves the neuron. It doesn't allow it to undergo apoptosis, that's cell death. It doesn't allow it to die. It prevents it from dying, then also maintains the integrity of the neurites. So the body will not detect that there is something wrong, because if there is a apoptosis, then of course the body will start producing antibody to combat the virus. So we can use the enzyme-linked immunosorbent assay. We have blocking ELISA, we have indirect ELISA. Then there is this fluorescent antibody neutralization test, which is the gold standard. So about 0.5 micro international units per ml of blood is protective. So when somebody gets immunized or gets vaccinated, you check for the antibodies, and using this method, if it's up to 0.5 international units per ml, then that person is protected against rabies. So the person seroconverted and the person is protected. And there is also rapid fluorescent focus inhibition test. This rapid fluorescent focus inhibition test was, in fact, I'm sorry to go back, FAVNT is not done anywhere in Nigeria. In fact, it's not done anywhere. In fact, it's the only place that they're doing it is here. Rabies Agricultural Research Council, the OIE reference lab, that's the WOW reference lab in South Africa here. They're the only people doing it in, at least I'm very sure, in West Africa and Southern Africa and East Africa too. We don't have it here. And unfortunately for this, we'll talk about this, of how they brought this to Nigeria, and Nigeria happened to the project. But rapid fluorescent focus inhibitor test, they were doing it at some point. I don't know if they're still doing it in ABU, when Professor ABU Gunkoya was still there. He told me that they were doing it there. So if you're going to do an international trade or pet travel scheme, is this FAVNT that you have to do to show that your animal is protected against rabies. So it's used for pet travel scheme. So what are the differential diagnoses of rabies? We have canine distemper, cerebral babesiosis, ehrlichiosis, pesticide and diamine poisoning, granulomatous encephalomyelitis, tetanus, botulism. Every disease that has a neurologic manifestation is a differential diagnosis of rabies. So how do we prevent this rabies? We've been talking about what this disease can do. How do we prevent it? We prevent it by mass dog vaccination. Once your dog is being vaccinated, once your dog population, at least about 70% of your dog population is vaccinated, then you know that that community or that country is protected. The country, the rabies is controlled, or let's say eradicated in such country. If you keep vaccinating about 70% of dog population. What about our cats? Do we vaccinate our cats? I've not seen anybody bring their cat for vaccination. You hardly see such thing. And cats, remember that our cats normally move. They don't stay like dog. Even if you have a fence, they will always find a way to go out, go into the bush, interact with wild animals, interact with dogs and all kinds of animals, then come back and stay with you. So I think that going forward, that we should be vaccinating our cats. If you must keep a cat, you should vaccinate such cat. This is the most cost-effective approach and most cost-effective and feasible approach of rabies prevention, because it's better to prevent something from the source. And dogs we know that dog is the main reservoir or host. If we vaccinate our dogs, we are sure that this rabies is prevented from spreading to humans. Then vaccination of our puppies. Normally we vaccinate our puppy once at 12 weeks with a low egg passage. The vaccine from Bonif is a live attenuated virus or killed anti-rabies virus. Now, my question is this enough? These are some of the things that I would like us to discuss. Is this enough? Because I know that here in South Africa, they vaccinate at 12 weeks and a month later. In UK, they vaccinate at 12 weeks, a month later, then another month later. That's after 4 weeks. They vaccinate 3 times before they now start vaccinating once every year. Now, because I was discussing with my supervisor here in South Africa and his collaborator, Lorraine, from APHA, UK. So they were because they do a lot of this FAVNC. They monitor the antibodies of these puppies that are being vaccinated. They discovered that when you vaccinate them once at 12 weeks, it seems that the maternal antibody will take up most of the vaccine and the animal is exposed. Then you now revaccinate again. So when they check their antibody titer, it's not always up to 0.5 at the first vaccination, 2 weeks after. You see that it's not up to that. But here in Nigeria, we don't have FAVNC to check. We just vaccinate once and that is it. We don't know if our dogs are protected. We don't know if they are not protected. All we know is that we vaccinated this dog. So I would like us to think about it, especially those of us in private practice, that especially those in canine practice, we should talk about this and know if we should adopt the two times or once. Then if you want to vaccinate your animal before 3 months, maybe something happened and you feel that your animal is exposed, or maybe the mother is not vaccinated and you feel that they're exposed, you have to use killed anti-rabies vaccine to do that. Then you use a high egg passage or killed vaccine to vaccinate your cats. So prevention of rabies in humans. Who should receive pre-exposure prophylaxis? Every veterinarian should do that. Every veterinarian should receive pre-exposure prophylaxis. I don't know the people that gave my director then about last year, they gave them vaccines, a lot of vaccines to vaccinate our students. I want to commend such an organization that do such things, because our students should be vaccinated. Here in the University of Pretoria, they vaccinate their students every year. Once you enter clinical class, you'll be vaccinated every year. And we should adopt that. I know and I heard that it was done previously, but I know now that when I was a student, I was not vaccinated. I started being vaccinated when I started working with this rabies. So it should be done, because sometimes our students are exposed. Like during my own time, when we were working at the teaching hospital, a dog, a Rottweiler, bit one of my my classmates, and that person was now subjected to post-exposure prophylaxis. And that would take more of the vaccine. Assuming she was protected, she would receive fewer vaccines. Then animal attendants, and animal handlers also should be vaccinated. Zoo and game reserve workers, rabies lab workers, rangers in wildlife conservation area, all these people should be vaccinated. They should receive pre-exposure prophylaxis. So what pre-exposure prophylaxis can they receive? We have Rabies. This is the one that I was using every year, but this speed A was what they gave to our director. So he gave me some, so I used this. So the dosage is 1 ml. You use 1 vial intramuscularly, or if you're using intradermal, you use 0.1 ml per dose. And this intradermal is very important, is very efficient if you are vaccinating a group of people, so that once you open it up, you will use it on all of them. Then we have the site of administration is deltoidus muscle in adults. And then you can do intradermal, where you use the anterolateral thigh or suprascapular region to give the vaccine. But this is not our thing. It should be, but it's better. It's important that we know this, because it's important, because sometimes we see that some of our medical counterparts, once they present a case of a dog bite to them, they don't know what they are supposed to do. They'll be thrown off balance. So it's left for us to tell them, this is what you should do, this is what you should do, and this is what you should not do. Then the schedule of the pre-exposure prophylaxis is 1 dose. If you're using Rabies, it's 1 dose each day on day 0 and day 7. Day 0 is the first day, and a week later. Then intradermal is 2 doses, each on day 0 and day 7. So you give one in the other anterolateral thigh, the other side, and the other thigh. Then you give it on day 0 and day 7. Then if you're using speed A, you will give on day 0, day 7, and day 28. That's how you should tell your medical counterparts what to do. Then animal bite and scratch. This is an example of animal bite and scratch. You see that here, there is no, in the first picture, there is no blood. Then the second one, there is blood. The third one, of course, this is a very deep bite wound. Like I was telling you earlier, these people will have different incubation period if they are bitten by a rabid animal. So wound management, this is very important, because sometimes when dog bites somebody, the first place they take the person is to the vet. They don't normally take the person to the hospital. They take the person to the vet. I've seen a lot of cases when I was serving at the night clinic one. They normally bring people that are bitten by dogs to tell us that what should we do. The first thing you should do is to wash the place with wash and flush for approximately 10 to 15 minutes, actually, using soap and running water. Use soap or detergent, whatever you lay your hands on, use it, because this virus is an enveloped virus. And soap, that's detergent, will destroy the envelope, and that virus will die. So you will wash it and remove as much as possible from the wound site. Then you apply chlorhexidine or iodine for disinfection of the wound. Then, of course, you would give anti-tetanus booster vaccination if the person if the person hasn't been vaccinated against tetanus. You vaccinate. Then you give antibiotic treatment, especially to those that are immunocompromised. You have to give antibiotic treatment. Then you give analgesia because of the pain. It's noteworthy to understand that we don't usually suture the wound, and also you have to avoid it, or you delay it. Then local anesthetics agents should not be used. This is because this will help to spread the virus. When you give such things, it has been shown to help to spread the virus, so it's not recommended. Then patients with animal exposure now, how do we categorize them? And what should be done when such a person is presented to you? These are some of the things that you should know and tell anybody that is bitten by rabid animal. So the category 1 are those that you don't have direct contact with the animal at all. So what you do is you wash off the exposed skin, you wash the exposed skin surface, and you wash the exposed skin surface. Then you don't need to give any vaccination at all. Then for category 2, there's direct contacts with animal, but no breach of skin, no bleeding, for example, bruising or superficial scratch. Wound management, you do the wound management, then you provide full course of anti-rabies vaccination. You give it, like those scratches I showed you, you give anti-rabies vaccination for that kind of person. Then category 3, that's the last picture where there is a deep wound bite, there is a skin, there is bleeding, contact with mucosal membrane, and all that. You do wound management. Rabies immunoglobulin will be given, and the full course of rabies vaccine. We have a human rabies immunoglobulin and equine rabies immunoglobulin. But unfortunately, in Nigeria, you hardly see it. I don't know if you can see it in Lagos, but I know that in Enugu, you don't find it anywhere in Enugu. So these are some of the reasons why we should try as much as possible to vaccinate our dogs, so that you don't be in this position of looking for anti-rabies immunoglobulin. What it does is that you infuse it around the wound area, and it will help, because it's an antibody, to help to bind the antigen, bind the rabies viruses that are around there, and it helps to reduce the ones that will go into the system. So let's talk about this Milwaukee protocol by Rodney Wilbur. This the GC case. This GC girl was a 15-year-old. She was 15 years, but she's now an adult. Was a 15-year-old girl who went to church, and a bat flew inside the church, and somebody hit the bat and threw the bat away. So she, in her kind nature, decided to pick this bat and know what she can do with the bat. Then this bat, she was then bitten by this bat, and the bite did not even leave that bite until the girl, forcefully removed the bat from her. So when she told her mom, the wound was dressed using a hydrogen peroxide, and that was all. The girl went back to school. She's an athlete. She went back to school to play her ball and all that. Then before her examination, she fell sick, and she started showing clinical signs of rabies. So they brought her to the clinic. So it was when they now got to know that there was a bat bite. That was when they now started suspecting rabies. So she was going to die if they leave her like that. So the Rodney now decided to try something on her by inducing coma to shut down her brain. So a coma was induced to shut down the brain, so that it will give the body enough time for the virus to build up. They didn't know whether it would work or not, but it worked. So the patient was intubated. She was even administered ribavirin and amantadine antivirals. Then the anesthetic was tapered off, where they saw that her immune system is battling with the virus. Then 6 months after her awakening from coma, she was given tetra, that's a vitamin B complex vitamin and folic acid. So this girl, it took her more than a year to recover from the coma, from the effect of the coma that was induced. And now she is still alive, but she doesn't do all those games and all that because of the effect of that induction of coma. So I don't think that anybody will wish to go through this, because this protocol has been, scrutinized by experts, and they discovered that this is not a way forward in terms of rabies treatment. But it's worth trying if you have all the equipment, because at least the girl is alive. So now we've been talking about rabies, what it does, how we can prevent it. Now let's talk about our Nigerian situation. What's the situation of rabies in Nigeria? This is where we talk about the introspection that Dr. Charles was talking about. Rabies in Nigeria. Nigeria, we have a unique situation where apparently healthy dogs are infected with rabies. Is it really true that apparently healthy dogs are infected with rabies in Nigeria? Because most of our research has been to go to slaughterhouses. That's slaughterhouses where they slaughter dogs, and we collect samples from there. Then we find out that some of the dogs were rabid, or they have antigen in their brain, but they were not showing clinical signs. Could it be that they were on their way to showing clinical signs before they were slaughtered, or that they were just apparently healthy? We don't know. This is a question that we need to answer. Then dog trading and dog markets further complicates the epidemiology of rabies in Nigeria. You can see this man by my right. This man is taking a lot of dogs to the market. The dogs are cachexia. What if one of these dogs has a rabies? What will the man do, and what will other dogs do? So these are some of the things that we should talk about. Then many Nigerian local breed of dog are bred for consumption. Yes, they are bred for consumption, because you see that especially in Southeast, I keep referring to Southeast because that's where I did my survey and my sample collection. You see that you see a family that just breed dogs for consumption. That's for sale. They sell it to those people that will consume it. They use it to pay their children's school fees. They use it to, to offset some financial burden. But this is what they do. They don't vaccinate these dogs. They just breed them. These dogs roam about. They don't take care of the dog. Unless maybe the dog is sick, they might just go get tetracycline and pour it in the mouth of the dog and all that. So these are some of the things that we need to look into as Nigerians. Then this local dog market that is growing, especially in Southeast and North Central Nigeria, it facilitates this dog trading. And remember that this dog trading also helps importation, and which our porous border helps to facilitate. Like I showed us from when I was showing diagnosis, we saw that some of the that's a virus that was gotten from the east was actually from Niger Republic. Just imagine the distance from east to Niger Republic is more than 1,300 kilometers. So you see the kind of transmission that this porous border can lead. So it leads to transboundary rabies transmission. So what are the sources of dogs in these markets? From my survey, I discovered that some of them are from household dogs, trapped stray dogs. Trapped stray dogs, these hunters, they just cook rice, then set trap, put the rice in the trap. Then any dog that goes to eat the rice will be captured. So they capture stray dogs or roaming dogs. Then The other dogs are roaming own dogs. People just catch it and sell it or kill it. Then imported dogs, like I mentioned before. Okay, look at this. These are some of the pictures from dog market. This is Orioba market. They normally keep their dogs in cages. Imagine one of these dogs being rabid. It will bite others, and then they will still sell them because this is their money. They will still sell those dogs and thereby selling rabies to other people. Then for Iboko markets, Ebonyi State, this they just tether their dogs. Imagine if this dog is rabid, this dog can bite the owner, it can bite somebody that is just passing, it can bite the person buying it. Then look at the third one, this Umpobo, the dog market. They tie these dogs so badly that they just keep them there. The people come to price and buy, and this is against the animal rights. It's against animal rights. So who is at risk of rabies? Is it the dog meat processor or the consumer? That is a question. Well, I would say that is the dog meat processor because when somebody is handling the rabies, handling a rabid animal, and maybe during the processing, he cuts himself and also cuts himself and maybe the brain or nervous tissue touches him in that spot, that person will get rabies. That person will get rabies. But for consumers, yes, the meat is already prepared. They just eat it. They won't get rabies from eating it because, of course, once the rabies virus, you can inactivate it at 56 degrees. So cooking it, that's boiling it, will definitely kill the virus. But this processing, and this guy, Cousin it out 2015, did a work on a dog meat processors where he checked the 92 dog meat processors, and he found out that 14 of them has antibodies against rabies. So what he did not tell us was whether they were consumers, whether they consume rabid dogs too, and all that.
I think you need to be running or we'll spend more than an hour. Hello, Prof?
Okay, no problem, sir.
Okay, give her a little time. Give her a little time. We finish at our 40 minutes.
Okay.
Per program. Okay.
So will dog-mediated human rabies be eradicated by 2030 in Nigeria? Is it a yes or no? Well, in Nigeria, poor surveillance will not, because once there is a poor surveillance, you wouldn't know the exact problem with the country. You wouldn't know the burden of rabies in the country because about 58% of Nigerian local government has not been studied at all.
I realize Prof is right because we need little time to discuss. Please, I realize it's right. Yeah, so okay, continue.
Okay. Lack of diagnostic facilities, dog trading and consumption, refusal of dog breeders and marketers to present their dogs for vaccination. This was the kind of thing I discovered during the last 2 years vaccination program, where some dog marketers refused to, and the breeders refused to bring their dog for vaccination, saying that a vaccinated dog, when you eat a vaccinated dog, you start having some sickness. Then we don't mediate, okay, this is still part of it. Then lack of government support, poverty, communal behavior as seen in rural areas, rabies in cats in Nigeria, what is the way forward? Rabies in wildlife, what the implication, and rabies in bats. So this is our situation. Our rabies is caught in a circle of neglect where poor diagnosis and surveillance leads to poor reporting and awareness, and it will continue to lead to poor submission, and this will lead to more rabies. So bat rabies in Nigeria, Eldolon Helvum, which was the bat Lissa virus, where Lissa virus Lagos was first isolated. And this, since that time, since 1956, this virus has not been isolated in Nigeria again. But you see that it has been isolated from other African countries, but not in Nigeria. What is the problem? The rabies in rodents, our Lissa virus monocola was isolated from pool viscera of insectivorous shoes. And since that time, Ogunkoya and Nottage have been able to detect antibodies against them, but not the virus. Since then, after it was isolated from two human beings showing rabies-like clinical signs. But it has been discovered in other African countries because of surveillance. The importance of surveillance, underreporting will mask the true epidemiology of the disease. Then, okay, let's just leave this. Then the dangers of poor Lissa virus surveillance in Nigeria is number one is that Lissa virus Lagos and Mokola originated and are still present in Nigeria. There might be unidentified Lissa viruses in the country. The current vaccine available in the market does not protect against Lissa virus Lagos and Lissa virus Mokola. The burden of rabies in the country is unknown. So if there is no surveillance data, there will be no funding by government and other agencies. Then surveillance, should we decide, okay, the way forward now, we need to improve on our surveillance where we will decentralize rabies labs, knowing and standardizing the rabies anti-rabies vaccination of our puppies, getting government, politicians, key policymakers to get involved, then enforcing dog acts, such as a responsible dog ownership, law enforcement agency in collaboration with VCN and NVMA, and involving community leaders, such as the Igwes and Obas and Emirs. And like a Edobala community in Nsukka local governments, there is a law. Once they see your dog outside, they kill it. So this is one of the things that made, when I collected samples, I didn't see any positive cases in Edobala. And involving religious leaders. Nigerians, we are religious people. So if we involve our religious leaders to talk about vaccination of our dogs, maybe they will listen to it. Then creating public health awareness, educating children in schools. Children, when you educate them, they are likely going to bring their dogs for vaccination. Then radio jingles and all that. So this is rabies prevention. These are some of my references. I would like to thank late Professor A.B. Ogunkoya, who was the person that really talked me into going into rabies. Dr. Chikamosu, who helped me. And when I was taught after my master's, he was the person that introduced me to my current supervisor, Professor C.T. Sabeta, Professor R.C.S. Okonkwo, and Professor B.M. Nene, who were my supervisors and also my home institution and sponsor of my research program. And Professor C.T. Sabeta, who has been of a very good help, helping me with my research and giving me a platform to continue to grow. And I'd like to thank my African Research Excellence Fund for funding my projects, Bluebird TV, ARC, and Rabies Lab, and University of Victoria, University of Nigeria, for giving me this platform to excel. Thank you for listening.
Thank you. Prof, take over.
Thank you very much. Yes, thank you very much, Doctor. That was a very beautiful presentation. Dr. Ukamaka Uchenna Eze. She has done justice to the topic and has shown that she has a practical experience on this subject matter, which is very, very commendable. I really listened with rapt attention the presentation, and I was impressed with the whole presentation. She has touched on areas that are usually neglected or could be a bit difficult for our colleagues, especially the younger ones. She has given us the rudiments as a professional and also talking to professionals about the perspective historically, the epidemiology, the etiology, the transmission, the clinical science, diagnosis, the differentials. All these are part of what she has presented. She has also talked about the prevention measures, including vaccination of dogs and cats, vaccination of puppies, which could have been a bit controversial before, but with her experience, she has shown us what is done in South Africa and United Kingdom, where double vaccination is given at intervals, and recommended that in Nigeria we can as well prefer solutions to our own issues, or we can adopt that. She has talked about pre-exposure prophylaxis, which is also very, very important, especially vaccination our clinical students. I'm glad when I was the dean, I introduced the vaccination of clinical students and clinicians in our VTH, just to protect them against contracting rabies. One area which I was also impressed is the issue of educating us on what should be done when there is a dog bite. It's very common. I have several times been getting patients from our own human teaching hospitals asking us, including the doctors, what do? They have a dog bite case. And she has given us the 3 categories of what we need to do. And this is very, very essential for all our veterinarians, especially the younger ones, where they could have challenges, either in their communities or in their places of work, with cases of rabies being presented to them. She has given us a very good diagnosis of our situation in Nigeria, that is rabies in Nigeria. She talked about dog breeding, dog trading, dog markets, dog consumption, and what are the sources of this. And I believe this is one area that has been neglected when it comes to rabies control. And I think the authorities should be concerned about these areas in order to protect our people. In a nutshell, I think I will say I will recommend this presentation to all veterinarians, particularly in our faculties of veterinary medicine. If Prof can send documents to all, maybe the chairman committee of them who will now send this paper to our faculties so that it can be presented to our clinical students and even some of our lecturers. This will help a long way in training them on what to do when there are rabies cases. Incidentally, I just finished my lectures on viral diseases, rabies of which I also discuss with the students. So I will share that with my own students because we have already covered this area, but I believe there are more insights into her presentations. I wish to sincerely thank her for giving us this insight, and also thank Dr. Chief Charles Ibe for trying to scoop her around. He's also good at that in that area where he'll always go and search on people that can be able to make a very good case and a very good presentation. So we thank Bluebird and particularly Chief for this wonderful opportunity to have Dr. Ukamaka to do the presentation, and which she actually did excellently well. The floor is now open for comments, discussions, and way forward. Thank you very much. Dr. Charles.
Yeah, somebody, Obai is asking a question. Hello?
Hello?
I can hear you.
I'm still lost. You can hear me? Let me
Very
see.
well.
Yes, I can hear
I can hear you, yes.
Yeah, I'm off a bit. I'm coming. Okay. Obai is asking whether it's compatible. The anti-tetanus booster is compatible with rabies vaccination.
Yes. Yes, it is. Anti-tetanus toxoid is a toxoid, while anti-rabies vaccine is a vaccine it's very much compatible. Even in pregnant women, it's compatible with pregnant. Don't say that because somebody is pregnant, you won't give anti-rabies vaccine. It's very safe. You can give it. It's very it's compatible with almost everything. Yes.
Yeah, okay. Please, more questions. But let me ask you one question. Do you think there is what is breaking the barrier between the domestic dogs and the Sylvatic dog and the jungle dogs? What breaking the barrier between two of them?
So you know that the problem is our domestic dogs, the hunters is one of that's the hunting dogs can go to the bush and get attacked by a wild animal, or our dog that our
Any link?
domestic
Because
dog.
most times these dogs
Sir?
don't enter the bush. And at the end of the day, they pick it up. Is there any link? Are you suspecting any link?
Yes, actually, okay, let me use South Africa here as an example. Their jackal, you know, jackals is a very big issue. And rabies in jackals is a very big issue here in South Africa. So what they do, what happens is that our dog, that's a rabid dog, enters into the wildlife, bites some wild animals. They've bitten, what do you call it? Even leopard, because they're not. Remember that they are not scared. They're not. Once they get rabies, they're not scared. So they've introduced rabies to the wildlife. Also, wildlife also introduce rabies to what do you call it? To domestic. But actually, the main thing is that when you do a phylogenetic study, you discover that most of the viruses in wildlife are from dogs. They are from dogs. So dogs that normally take this virus to them. And also sometimes because the wildlife is not as they don't vaccinate them as often as they vaccinate here, or they don't even vaccinate them at all. They bring in the virus again to our domestic dogs. So you see, for Nigeria, I will assume that the problem is these our hunting dogs. When they go into the bush to hunt, they can encounter anything, and that thing may bite them because they run away from the person going with them, the hunter, to go and search for all these animals. They might be bitten by a rabid animal, or if they are rabid, they will be bitten, they will bite another animal, and you know it's a crazy circle. So they will continue to be spillover from wildlife to domestic and domestic to wildlife.
Yeah, that's okay. I think the hunting dogs should be a suspect, a serious suspect on this issue. Then somebody is asking, somebody is asking about the possibility of transplacental or intrauterine infection to the fetuses from the infected dam.
Well, that has not been discussed because once rabies starts, it doesn't give time for that kind of a long time for animal to deliver, to do this. It hasn't been studied. I've not seen any study on that.
Yeah. And so I think it's given for more studies.
Yes.
Yes, that's why we're here. If there's anything that is fishy, then it has to go to the study lab. Okay. Somebody talked about what to do in terms of cattle and horses, rabies. Is there anything to be done? And before Bye Jennifer, who is raising her hand, for her hand drop off. Yes.
Okay, so for cattle, you know, you can't start vaccinating cattle because, you know, remember that our vaccine is just for dogs. The vaccine that's been that is in the market is for dogs. And in fact, we're even there's a study where the small breed of dogs seroconverts. That's they have more antibodies than bigger breeds of dogs. And I was thinking, and some people were thinking that is because you know, a dog that is weighing 35 kg will be given the same dose as a dog weighing 5 kg. You understand? So now talk about a cattle that is weighing so much. So if a vaccine will be produced for cattle, it will be so much. But why would we even want to go into producing vaccines for cattle when you can help stop rabies in dogs? you channel that money into stopping rabies in dogs, and cats will be free.
Yeah, beautiful. I think Obai is she still there? Jennifer Obai, unmute yourself and then make your comment.
Okay. Good morning, sir. My
Good morning.
question was actually if the tetanus toxoid is compatible with antibiotics, not with the anti-rabies virus.
Okay.
Thank you.
So, is there
Yes,
anything you can tell us?
Yes, it is, because anti-tetanus toxoid is against the toxin, remember, not against the bacteria. It's against the toxin produced by bacteria. Do you understand it?
Yeah, you're right.
Yes.
Yeah, you're right. Okay, continue. Sister, have you dropped off?
I think she's done. I've answered her question.
Okay, you've answered that question. Yeah, another thing, introspection. There are some areas of research that we're going to throw up. You know, you mentioned about bats. My late mom told me that before I was born, she was in a hospital. A bat just came in from nowhere, beat somebody, and disappeared, and the person having signs of rabies. It looks that from an introspection point of view, we should go back. We should go in again, more further introspectionally, to start looking at bats and other animals.
Yes.
Do you understand what I'm saying? So
yes, sir. Yes,
Hello?
And I'm here. I said that what you said is true. You know, the problem we have is that Nigeria, we don't usually get enough funding for some of these studies. Rabies studies have not been getting enough funding. And so, but it's a very good thing, because I believe somewhere, somehow, that it's not just Lagos bat virus that is in Nigeria. We have other viruses, because some studies, one of my colleagues in UNN, Dr. Linda, when she did her studies, she saw Duvenhag antibodies in bats. If there is Duvenhag antibodies, that means that there is Duvenhag rabies, Duvenhag Lissa virus somewhere in those bats, because they couldn't just pick up the antibodies from nowhere. I don't know if you understand it. So we need to really look into bats. I've been writing proposals to study bats, bat rabies in Nigeria, and I hopefully maybe one of them will go through, and then we can do that.
Yeah, I think from the observation, we are just trying to put our heads together. There are some secret climaxes. Hello?
I'm here.
Yeah, there are some secret climaxes. You know, when in the West Africa, the canny climax, where dogs are, animal in the dog family are the preferred host. There might be some preferred hosts we have not been able to stumble across. No, from my own wider spectrum of understanding, based on what you said now, I'm trying to sieve. Thank God we don't have jackal in this part of the world, but we have hyena. We have wild dogs in this part of the world. We start looking at hyena, and the people are playing. I've seen a lot of people in the north playing with hyena, even speaking Hausa to them, and then they are responding. So we need to look at, and then social interaction with animal to some extent, especially wild animal, supposed to be curtailed. And you know, people do most of the things we do in this country out of ignorance. And then, but once they have the knowledge, I mean, they might adumbrate. Because the world here is 2030 or whatever, the rabies should be zero. You're like, pace is zero right now. So there's a concerted effort from every angle. And that's why we make this today. We make today a priority to discuss this. And then to Professor Junaid Abdulkader, we have this is in the, we will discuss actually, is in where we're streaming it in YouTube. And like you said, we see how we can pass this round and round and round to those who study rabies, especially the veterinary faculties. There was a time I went to Gambia. My friend, a pediatrician, I stayed in. They were having seminar in pediatrics, and I was there in the seminar room, almost sleeping and listening. And he asked one question they asked, and he said, good day, Tim, my friend, a vet doctor from Nigeria is here. Yeah, what do you think about dog biting rabies? I told them, every dog bite is a suspect unless you'll be able to disprove it. Yes, whether provoked or unprovoked. Just like you said, I say in a disease that has a case fatality, you don't joke and mess around with it. Maybe the beach, the person was bitten by a beach, we may enter into the territory when he was well, agreed. But let's rule it out. Or before entering into a problem. And they said that was a nice way. There is a nice answer I gave them. So that's it. The case fatality of rabies is 1 or 100%. That means anybody that's gotten to the clinical level of having clinical sign dies. Again, how long does it take for dog giving anti-rabies vaccine to develop immunity for rabies? Man, somebody just asked this question.
It's 2 weeks. It's 2 weeks.
2 weeks.
It's 2 weeks. You start checking it from 2 weeks. Yeah.
Okay. Yeah. And our question, we need questions and comments, which is important. That's why I think Prof wanted us to curtail the discussion from our speaker so that we can have time to trash a lot of things. But Professor Abdul Kadir, I will send you the video of this from YouTube and make sure that.
Thank you very much, Charles.
Yes, I will say definitely. And the slides
I think it's a very good. I think it's a very good one. Yeah. All right.
Yeah. Yeah, the slides are
we'll share it with our students, and I'll recommend that our can have it.
Yes. So that is it. We have one Tara. She's a musician or guitarist here. And before we go, we recognize some of our, anyway, that will be at the spot of going. We'll recognize some of our guests here. Some of them outside the country, South Africa. I've seen people in Cameroon, South Africa. We have seen Asenta Samanda. I think she's from South Africa. A lot of people are here. And I thank you, Amaka, for bringing a lot of people. And then I thank Professor Ekene Ezendoka for figuring and fishing you out. Ukamaka, you were fished out by your colleague at UNN, Professor Ekene Ezendoka. She was the one who recommended you to us. We are not, we don't work in isolation. We are limited, but the only thing is that areas that we are limited, that we got some, we need have some elasticity, through which we can stress it. And please, let there be inter-research institutions and inter-university research collaboration. That's what we are trying to do. Let there be a collaboration. I will see UDUS, UNN, UI, Makode with, these are collaboration. Let us not exist in the syntax of compartmentalization. That's what we are fighting. Let there be inter-collaboration among all our research entities, collapsed into one. Maybe with MVRI, we might get something that goes very well for all of us. I remember one international summit I attended in Denver, Colorado. There are certain things I presented, like Gomboro in 18 weeks, which is unheard of all over the world. They were interested in America. They really want me to give them more information so that they can go start researching on it. Start developing some tropical environment, simulating tropical environment to raise beds to see whether they can get what I get, because areas expands and differs. Anyway, is there any question again, or are we calling it a quit? for today. I think
I
we've
think
done justice.
one area which I think we need to also emphasize in that collaborative research is, apart from studies in bats, we need to conduct some studies
Good.
in stray dogs, in hunting dogs, in trade dogs, and in market dogs. This will help us greatly in assessing the real situation. And this should be a continuous exercise. We need to be conducting surveillance on that from time to time, so we can have our records very clear and very straight. That's what I think we need to do. And I think this can go across the regions, across the universities where this research can be done. I'm pretty sure if we can be able to get a very good funding, this will go a long
There are
way
a
in
lot of work
improving
to be
the
done in this context.
status of
Yeah.
of rabies in Nigeria.
Yeah, Adogoke Agbabiaka wants to talk. Please unmute yourself and then discuss with us. Agbabiaka.
Good afternoon, everybody, my senior colleagues and my supervisor, Dr. Ukamaka Eze. I listened to the presentation and something struck me there when she mentioned that there's underreporting of rabies cases in Nigeria. So it's also drew my mind towards other lapses we are facing in the country in the terms of both parasitic and bacterial diseases, where there's also underreporting. But then we are in an age where technology really drives a lot of things, and specifically data collection. So I was wondering, now that I've mentioned that there is underreporting, what is being done in the country, at least, to help us to collect this data accurately and also drive us in the right direction by pointing out where we might have these certain lapses, because it does not just end with maybe community leaders, like she rightly mentioned, and all that. Data collection guides our therapy, and it can also point us in the right direction. Instead of us to be tackling so many things at once, we can just pinpoint exactly where we need to put our hands on deck into. So what is being done towards data collection and how we can use it to improve our policies and also guide therapy? That's my questions.
Okay, Uche, welcome. Thank you for your question. And thank you for listening. We have a problem in Nigeria. The problem we have in Nigeria is so enormous that sometimes I just sit down and I think about it. Number one, poverty has really dealt with Nigeria. In fact, that we have underreporting. I can say that the first problem is poverty. Why did I say that? When an animal has rabies, the ideal thing that should be done is to take this, take the sample, or maybe take the brain or the head of the animal, or maybe if an animal is behaving somehow and is killed, you take it to the nearest vet's clinic, if there are actually vet clinic in those areas, because that's another thing. That's another thing. But you see that what happens is that once an animal is behaving somehow, they kill the animal and eat it. And once that is done, you don't have any question about it. Now, somebody's child has rabies. Instead of reporting it to the nearest health center, they will say that it's an obanje or something, just find something and call it, and then they bury the child. If you tell the person to report it, say that you are laughing at me because my child died. These are some of the things that we need to, we need to change our mentality towards a lot of things. Like here in South Africa, if there's a rabies case, they bring it to the nearest, they have rabies diagnostic centers in different regions. They take it there. I've seen cases coming from as far as Eastern Cape to Pretoria here. for diagnosis. And once a rabies case, that's a rabid animal bites a human being, that person goes straight to the hospital. That person is given free anti-rabies post-exposure prophylaxis. We need such things for it to be. If I know that if I have rabies, if I'm bitten by a rabid dog, that I go to the hospital and I'm given free anti-rabies vaccination, the full cost, the 5 of them will be given free. Even the immunoglobulin will be given free. Here in South Africa, if I have such thing, if I know that such thing will be done to me, I will, Dr. Nwokolo, please, can you mute yourself?
Well, mute yourself, young man. We've muted a lot of people. They'll mute themselves. Mute yourself, please. Oh my God. Mute yourself, I will take you out. Please. And Samson, do your work.
Put her inside that plate.
Samson, like do your work. Do your work, please.
I'm gonna buy you something. Go somebody. I'll follow you. I think your classmate.
Dr. Nwokolo, please, can you mute yourself?
Dr. Nwokolo Kamaka, just give it to I want to talk.
Dr. Nwokolo Kamaka. Please, please.
So,
okay, continue.
So these are some of the things. Yeah, these are some of the things that really makes reporting easier. It makes reporting easier. It makes reporting easier because that person that goes to the clinic will be recorded. It will be recorded. If there are cases of dog bites, it will be recorded. If there are cases of animals that die of rabies, it will be recorded. They have the data in their reference lab. They have the data in their different, what do you call it, rabies diagnostic center. Let me shock you. The only place that we diagnose rabies in Nigeria is in MVRI. A country of more than 180 million people diagnose rabies only in a place. So when there is a rabies case,
a lot of topics are coming up. Continue. A lot of topics are coming up.
They bring rabies case to you, and you see that you don't know how to diagnose it. You don't have what it takes to diagnose it. Then you will send it to MVRI if you have the money, because the victim most of the time will not have money to send it there. Then when you send it there, MVRI will now do the DFAT and will now tell you the result, whether it's positive or negative. So you see that is a big problem for us in Nigeria. Okay, let me shock you. During 2006, 2005, 2007, I was still in secondary school then, but my supervisor and the people here in Rabies Lab told me there was this twin projects by OIE, that's the World Organization for Animal Health. They chose Nigeria. And they came to Nigeria to give to train the staff of MVRI Rabies Lab on how to do this FAVNT, so that the burden will be less for them in South Africa. Do you know that they trained them, they gave them the equipment, they gave them everything, the microscope, everything. But do you know that that lab did not start even as we are talking today? Nigeria happened to that lab. Do you know how much they make from rabies and FAVNT? Some of our clinicians in Lagos that do pet travel scheme, they will tell you that they send their samples to South Africa for them to do the FAVNT, because that is the only place they can do it. But Nigeria, we had the opportunity of doing that. We didn't do that. We didn't continue with the building. They built a lab, equipped it and all that, but that thing did not take off, even for one day. So our reporting will be a long, in fact, I don't know if we can build, because I believe that at least every region should have a place where they can diagnose rabies. With that, we will have enough data. With that, we will have enough, at least surveillance will increase. And educating our people that you don't keep quiet when you have something. This disease is a reportable disease. This disease is a reportable disease. Don't keep quiet. Don't, if there's a rabid dog, don't eat it. Even if you will eat it, just cut the head and give us the head. Then you can eat the other one. In fact, that will help.
Yeah, Nelson is raising his hands. Nelson, do you have anything?
Yes.
Nelson, unmute yourself.
Let me start by commending Dr. Ukamaka for that wonderful presentation.
This girl, who is this Ukamaka? Who is Mokolo? Who is this Mokolo? You must
Please
you
unmute
unmute
yourself.
yourself. Okay, continue.
I'm much impressed by your work. I'm really, really delighted that you've done this work so extensively, and it's an applause, and you've given yourself much. And I just pray that the reward you've put into this is going to be far, far beyond your expectation. I want to cite a incident while I served in Jos as a copper based on this rabies issue. When I got to Jos to serve, I was privileged to carry out anti-rabies vaccination. And what prompted me in doing that was because when I got to Jos to serve, I discovered that they had a lot of have a lot of roaming dogs littered all over the whole place. And I began looking for what to do as part of my MDG goals to help to harness the challenges prevalent with dog bite in Jos. Could you believe that when I went to some of the local government chairpersons, chairmen, even the then director of veterinary services, it baffled me the way and level people were just turning down this offer because they felt that probably they didn't see a need for what I wanted to do. But as though it may be, I still was not deterred. I went ahead, carrying out my MDG goals. And by the time I left Jos, I visited virtually all the local government in Jos, and I vaccinated over 600 dogs, and that earned me a state award. I was the best copper of that year, and with other, laurels I achieved, Now, I'm just wondering how Dr. Amaka is able to carry out all this, because I know sometimes reaching out to people, especially when it has to do with these dog things, it could be very, very disappointing and a lot of disdain. People do not even appreciate what you want to do. People sometimes look at you as though you don't have something significant to offer. So in my own little way, I'm just trying to imagine how she was able to carry out all this and still was able to do a whole lot. Let's come to think about it. Anti-rabies, it's very, very prevalent, especially in so many regions. And we need to find a way to harness this based on Dr. Maka's recommendation. And I pray that, furthermore, we'll try as much as possible to, see what we can do to reduce the incidence of dog bite. Thank you very much.
Yeah, thank you. Thank you, Nelson. Another thing I want to say here, I think we're coming to the end of this conversation, is that it's not all anti-rabies vaccines work. Not all of them work. We need to do post-vaccination seromonitoring. We were able to eradicate rinderpest in this country through seromonitoring as part of the ingredients of eradication. There are a lot of things that were involved, but seromonitoring was part of it. Most of our public health concerns, when it comes to zoonosis, I think seromonitoring should be part of the exercise. If you really want to have a compact package through which you will be able to control these diseases, I think sero monitoring should be part of it. Ukamaka, what do you say about this? So that
yes, sir. What you said is true. What you said is true. Sero monitoring is the main thing, because if you don't sero monitor, you won't even know whether your vaccine is working or not. We just get vaccines, we import vaccines, we just give it, and we assume that yes, this animal has been given vaccine. No, we don't do such thing. Now we don't even have what it takes to do sero monitoring. That is it. And if MVRI is ready, because the funny part of it is that those people that were taught that FAVNT, which is the sero monitoring that we are talking about, because FAVNT, the good thing about FAVNT is that it measures the neutralizing antibody, the rabies neutralizing antibody. That's what it measures. So if MVRI is ready, because those people that were trained, all of them are retired. Those people that were trained to do those FAVNT, all of them are retired now. So if we will have to start afresh. So Nigeria will really bring their money this time, not just somebody giving them everything and fulfilling them, and they will not take the advantage. They will bring people to come to maybe South Africa here to learn it. The funny part is that I didn't even learn the FAVNT because it takes 6 months to even understand, to master it. It takes 6 months to master it. So I told them I'm not interested, because if I master it, where will I use it? We don't have where to use it. So I didn't even bother going into that aspect. So, but if we are ready, because my supervisor, I was talking with him, he said that if we are ready, that they can revitalize that twin project, if we are ready to start that. They make a lot of money, sir. 2,000 rand, 2,000 rand per sample is about 165 or 168,000 naira per sample. Multiplied by 73, that's they do 73 every day. Multiplied by 73, they multiplied by 22. You know how much they make in a month. But we didn't take that advantage. And if we want to sero monitor, we can't be sending our samples outside Nigeria. We should be able to do it in Nigeria. That is the truth.
Yeah, if Beijing wants to say something.
Thank you, sir. Good afternoon or good morning, everyone. Just a minute to 12. Thank you, the presenter. It's been a very beautiful one, Dr. Amaka. We appreciate you. But sir, where I'm coming from is a kind of an observation. If you notice very well, for us in the private practice, we have majorly concentration of vaccination in the cities, because those who own dog in the cities are the ones who usually come for this annual vaccination or even initial vaccination. Nothing is done about those who are in the very hinterland. And whenever you go to those areas, you find out that they have more of the roaming dogs down in the hinterland than they have in the cities. It becomes a challenge because we have also allowed the dog ordinance that we had pre-colonial and early post-colonial times to die, wherein people who own dog just let them to go, roam around the street. We no longer have dog licensing, all those dog tags and all of that. I think we may have to, as a community of vets in Nigeria, as part of this quest to eradicate rabies by 2030 or thereabout, to go back to the enabling laws, just simple laws of everyone who owns dogs should be responsible for those dogs and not just letting them move around, as a way of curtailing most of those contacts. Not that it all are eradicated though. Then how do we now take rabies vaccination to the hinterland?
Yeah,
yeah,
he will.
Hello, sir.
It does what you think that can be right.
Yes, sir. The people in the rural area, I know that during World Rabies Day, my then director, Professor Anaga, he was taking some lecturers into those places, and they were responding. They were responding. He would take them to the rural areas, to vaccinate these animals. We should, as vets, because those people in rural areas, they don't have access to veterinary clinics, because veterinary clinic, because even the government clinic, like my friend Chimatara, the Tara lady that you were talking about, she served in a rural area. The vet clinic she served in rural area as the local government veterinary clinic. She said that there's nothing there. There's nothing, not even one single antibiotic. Nothing was there. So imagine somebody coming there with a rabid animal or with a case of rabies. There's nothing that could be done. So what I'm thinking is that as MVMA, let's make use of our students. Let's make use of our students. During World Rabies Day, we should bring vaccine. Then share these students, bring money, or even the Ready Sea people that are bringing vaccines and giving us vaccines. Then we should be able to, as a kind of humanitarian service, take these people. Because if we wait for governments, I'm telling you, nothing will be done. Nothing will be done. We should take our students, share them into these rural areas so that they can go and vaccinate people.
Yeah, I think
like Eugene was when we were talking about rabies last year in radio station. We talked about there in Enugu State since 2005. There have not been any appointments of a veterinarian. They've not employed a veterinarian in Enugu State since 2005. So you can't even tell those. So there is nobody to even do the work in government.
Yeah.
So it's a complicated issue.
Most of things
Sorry, can I talk?
We are going to channel, please, and we are going to channel all these things to the Chief Veterinary Officer of Federal Republic of Nigeria. They are involved in animal diseases control as empowered by Animal Diseases Act of 1988 and then amended in 2022. We have, statutorily, the structures through which we need to go through. It's not about MVMA, it's not about VCN. Now, when people talk about VCN in a disease control, I'll laugh because it's not part of their schedule. VCN is to regulate the training and practice of the practitioners and not to regulate disease. So let's take it, and Professor, thank God, Junaido is a professor of public health. There are two institutions. The Veterinary Council of Nigeria regulates the practice and training of veterinarians, while the Animal Diseases or Animal Health Department of the Ministry of Agriculture controls the disease. It's an organ for surveillance and disease control. And really for us there's something Ukamaka mentioned here. VOM is too centralized for our liking to be able to do what's supposed to be done in the country. We need regional labs. They have regional labs, but they are next to nothing. I think there's one in Kaduna here. We commissioned one in 2009 in Mudike. I don't know what is going on in that place now. Most of their lab is to sell vaccine. That's what they are there. Doing diagnosis, like diagnosing rabies, is not their concern anymore. And then another thing I want to discuss structurally. When I was MVMA president, I make a memo. I defended it in Agri Council in 2011, meeting in 2011. Establishment of primary veterinary centers all over the local government, 774. Each of the 774 local governments should have a primary veterinary center. I think from where I got it was the meeting I had in 2010 or thereabout, the World. Then I had what do you call it? I had in Cape Town in South Africa. That's what the first time I heard about it. I came there. So what we need here is to have such structures at the grassroots so that information can taper up. So who again has something to say? Anybody, you have something to say? Unmute yourself and then we'll round up.
Thank you very much, sir.
Yes.
We're two veterinaries doctors here, Dr. and Dr. Mr. Nibili. And one thing I want to say that I want to stand in for the Lagos State government. I want to appreciate the Director of Veterinary Services, there's in person of Dr. Macaulay Rashid. For the past 4 or 5 years now, our commissioner in person of Ms. Abisola Olusoya, we have been doing kickstart program of rabies vaccination all over the states, that is in Lagos State. And we've even gone as far as going to the hunters, to the riverine area. And I'm sure some of you would have been seeing pictures of what we have been doing in the past. So for cats, as Madam has earlier said, we've been vaccinating cats also, even monkeys. And we've been doing an average of about 3,000 to 4,000 rabies vaccination in all our pets. That's for Lagos State government under the Veterinary Services Department. And I'm sure you can also witness that which we're doing about anthrax vaccination. So Lagos State government veterinary department has been doing anti-rabies vaccination for the past 4 or 5 years. And it's a continuous program and it's an annual program also. Thank you very much, Madam, for your presentation. That was a lovely presentation. God bless you, ma'am.
Yeah.
Thank you. Thank you. That is very commendable. I think others should borrow. Other people should borrow a leaf from Lagos State, because if every state is doing this, before you know it, rabies will be
eradicated.
Yeah, yes.
Dr. Nebeli, please, is there any way you do a compendium of what you're doing? Put it up in a literature so that all the veterinary schools will have them. All the, what do you call it? All the directors of veterinary services will have them throughout the country.
Thank you very much.
If possible, the chief veterinary officer who might disseminate them, either reproduce them or something like that.
Thank you very much, sir. God bless you, sir.
Okay.
I'll get my director.
I'm in Lagos now, so to say. I'm in Lagos.
Welcome to Lagos.
I went to commiserate my friend yesterday. So that.
Okay, the 2 of us were there 2 days ago. Dr. and Dr. Mrs. Edward Inibili. We were also with Dr. Abiaditu.
Okay. Yeah. So it's okay. It's okay. Who again? Is it Joel Ogunaike? That's 161 Joel Ogunaike. That's where I am now in Ikeja JR. So who again has something to say? So that I can call. Professor Junaidu, thank you very much. I think we are far done. Dr. Tara, I think it's from South Africa, a guitarist.
Oh, she's from
here
UK.
with us.
Thank you very much,
Dr. Tara, you are welcome. Ukamaka, you have to pass all these video to them, sir.
Hello.
Junaid, you can talk, please, Prof.
Yeah, okay. Thank you very much. In fact, I have been struggling, but it is because of your commitment that I have to do this. The place I'm doing this is in the hospital. My sister is undergoing surgery. I was there. So it's in the hospital, in the Zamia hospital. That's why I'm doing the program. Just because of the commitment you have shown for that. If I'm to be here, I said I have to. Hello, are you hearing me, Charles?
Yes, we're hearing you.
We're hearing you. Thank you for that. Thank you. And your sister is here. That's our prayer. So
yes. So thank you very much, and let me say a big thank you to Dr. Ukamaka and all those that have participated for this program. We wish you all the best and happy weekend. Thank you very much. Over to you, Charles.
Thank you. Yeah.
Thank you.
Please, we have this video. We will send it to all of you as a disseminating point, as not as a terminus. All these videos we are sending it as a dissemination spot.
All right.
Yeah. So that's it. It's in the YouTube. It has been streaming. But you see, to encourage us, please be advising them to subscribe to our channel, because really we are putting a lot to make these videos. We are putting a lot in data, a lot in Zoom subscription, but that is okay. But the important thing is that why we are doing this, let it work. There are a lot of gaps we need to bridge if we're able to control diseases. I want to see somebody in Udus collaborating with somebody in Umudike, somebody in ABU collaborating with somebody in Ibadan, in all the diverse areas of our study: disease control, practice, animal production, and name it. So please, that is why we are coming up as corporate social responsibility. People who are corporately, socially, and responsible, to be able to see some information gaps, and we are plugging those information gaps. I thank you. At this point, I think we should be calling it a day, to be frank with you.
There is a question in the chat
very,
that
very
I want to answer.
Okay.
There's a question I saw in the chat that I want to answer. Yeah, the person was asking, how does rabies hide from the immune system? Like I said that it does not it prevents apoptosis. That it prevents cell death. That's the main thing that it does. So the mechanism through which it does that, we don't know yet, because a lot of researches are still been going on. But it does not allow the cell of the animal to die. So that's how it's.
Yeah, once the cell dies, they will die with the cell. You see, nature is very powerful. Once apoptosis takes place, they go with it. And why should they go with it? So what they do is that I think God gives them a system to say, what will cause survival of the fittest? You must survive. Just like you don't eat food, you will die. That's why we all look for, we are gluttons. So that is it. This nature has its way of protecting creation. Every creature created by God, God gives it what it does. It will use to protect itself. Be it human, be it virus, be it bacteria. And that's why we have bacterial resistance to antibiotics. So that is it. But we should go further and do the anti-apoptosis. What happens, how if they were able to see whether human being can use drug or medication to cut down it off. Okay, thank you.